Hello, everybody. Welcome to another episode of Health Ignited, where we're igniting your health freedom through education and inspiration. And on this platform, we're talking about a lot of different things, but when it's just Dr. Sonya and I, we often talk about hormones and some of the things that we love to chat about. And today I'm at the clinic. She's at home. We're finding time in between our days and our boys and life to record. So, Sonya, how is everything at the house?
Good. Actually, really happy to be here today. Have the house to myself. It's always
Yeah.
nice. Yeah, some
Sonya
quiet time.
you got an IV yesterday,
I
and
did.
you love your IVs. It's been a while since you've got one, but we always have a little trouble after your IV.
Yeah,
So
I
you
don't
have to
know
do
what's
some
happened.
self-care.
That's right. I've been doing them for so many years and used to get them every week, and now it's maybe once a quarter because of the pain that I'm in afterwards. So it's an interesting phenomena.
Yeah. So it's not the vitamins that they get her in pain. I think she gets
No,
traumatized when I give her a
that's right.
needle, and then she gets a little inflamed and
Irritated.
tense, right? A little irritated. She
Yeah,
bosses me around, making sure I'm doing it right. And so I think the whole ordeal with giving you an IV tends to be a little emotionally disturbing.
I think so too.
Yeah. But it
Yeah.
was quite amazing. I mean, you said this last night too, that the alertness, because you've been like just flat out, your hormones have been tanked at the end of the night
hmm
and sleeping on the couch, at the end of the day. And you were full of energy last night after your
I
IV.
noticed a huge difference after those IVs. That's why I miss them so much because I know they do replete me, especially when I'm in a phase where I'm feeling a little bit depleted and in my second half of my cycle where I feel a bit more depleted always. So having IVs during that time is really helpful. It's just unfortunate that I have to move through a little bit of pain the next day.
Yeah. Yeah. So she woke me up in the middle of the night. And speaking of hormones and circadian rhythms and things like that, I had to massage her. I don't know for how long I was massaging you. I fell asleep with my hand
30
on your.
seconds.
Oh, come on. It was longer than that. You woke me up, grunting, groaning, and I was massaging you for at least 60 seconds or longer. But it felt like it was at least 5 to 10 minutes,
Hmm.
possibly. Right?
No.
Okay. Anyways, let's digress into the topic we're going to be discussing today, which, funny enough, would be correlated with a lot of our discussion around Sonya. And Sonya, she's 41 years old. She's in this sort of window of time, which is very interesting for women, which she's going to speak to. And there's this phenomenon that probably a lot of people have heard, especially probably more women than men, but of estrogen dominance. So speak to this time of your life, Sonya.
Yeah, it's an interesting time because after children, your body shifts, your hormones change. And after 35, especially, it's one of those things where you hear about things changing in your body. And when it happens, it kind of throws you for a loop because you're not really expecting it, especially when you're trying to do all the right things and you're eating well and you're exercising and you're taking the supplements, and yet you notice this real significant change in your body and your hormones. And so I started to feel slightly different after 35, and I had our youngest son at 35. So there was that combination of pregnancy and my hormones shifting. And 40, there was a huge difference in how I felt when it came to my hormonal cycle. So during these years, women are more prone to estrogen dominance just because progesterone and testosterone have been declining since age 25. And with every pregnancy, we're losing about 15% of our testosterone as well. And now our estrogen is also starting to shift. So there's these moments or these years where estrogen tends to kind of dominate, and not necessarily the estradiol, but estrone is trying to show up now a little bit more because it's the hormone that's going to take over when women shift into menopause. So I've been noticing this change in my luteal phase that wasn't necessarily there before. I first noticed it after Soren, so our second son. I think 6 months after pregnancy, there would be a day in my cycle where everything would shift. Like, you were irritating me, the world was irritating me, and I could pinpoint exactly what day it was. And it was always right after ovulation. So I knew my luteal phase then needed some help, and I did support it, and it kind of shifted for several years. Become 40, that time is feeling more challenging. Like I have to stay on top of everything even more to make sure that these last 2 weeks of my cycle are smooth, or else I feel the breast tenderness, or else I feel just that change in mood and outlook in life and energy. So all of this starts to happen because my progesterone isn't necessarily getting a chance to thrive in these 2 weeks because it's deficient right now.
Mm-hmm. So you mentioned two different types of estrogen. Can you just lay out for women and men, because it's obviously affects us too, what are the three different types of estrogens, and how do they interact with the body?
Yeah. So estradiol is the estrogen that's dominating when we're in our menstruating years. And estriol is a weaker estrogen, but it's high when we're pregnant. And estrone is the one that kind of shows up after we move into menopause. All three are present throughout our lifetime, but they play a different role. So one is going to be more dominating than the other. But when that shift is happening between the estradiol and estrone, that's where the challenge starts to show up, because estradiol is really meant to help support our bones. It's meant to support our mucous membranes, our skin. It creates more flexibility in our arteries. So it's a really supportive and nurturing hormone for different parts of our bodies. And when that's starting to tank during menopause, that's usually when women start to feel the hot flashes, the night sweats, the vaginal dryness, skin dryness, memory loss, incontinence. Like there's a
Weight
huge list
gain,
of
I guess, too.
things, weight gain around the abdominal area, and osteoporosis. So there's a huge list of things that you can see that estradiol is supporting us in during our menstrual years. But unfortunately, the estrogen and progesterone, they kind of get attacked through our menstruating years because of our lifestyles and our environment and the toxicities in our environment. So then that's why that transition period from 35 on can be really challenging for a lot of women.
Yeah, and we see this in our practice too. A lot of women are entering into this perimenopausal challenge, what seems to be, excuse me, earlier than maybe before, because of all this extra pressure and toxicity and stress in our lives. So now, with regards to testing, can you test for estrone, like, in your blood, for example? Like, how does one know when they're in estrogen dominance and when that's
Mm-hmm.
playing a role?
Yeah, so blood can be great to measure estradiol and different points of the cycle if you're still cycling. So you can do a test between day 3 and 5, and then another one between day 19 and 21. So essentially, you're just looking at estradiol at that time. And when we're doing a blood test, the hormones are coming out in pulsations, so it can vary from one moment to another. However, by doing, your measurements on day 19 to 21, you can kind of look at your estradiol and your progesterone and just see the ratio that it's kind of playing out in those days. More accurate would be a Dutch test. So looking at your urine and looking at your metabolites. So that's where estrone can be measured. And also you can measure the metabolites of estrone. So there's a metabolite of number 2, 4, and 16, and each one of those play a different role. Like number 2 is very protective. Number 4 has the ability to change our DNA, so it can be problematic. And 16 is the one where if that's too high, there's estrogen dominance. If that's too low, there's estrogen deficiency as well. So it's a real fine balance between these estrogens. I think a lot of time when we hear estrogen dominance, we kind of make estrogen like the evil part of our hormones, but really it's necessary. It's just it's gone off balance because of the environment and other stresses.
So women who are presenting with, say, low progesterone in relation to estrogen, or some of these mismatched ratios between the 2, the 16, and the 4, what are some of the more typical gynecological issues that women are dealing with that we see, I mean, more and more of,
Yeah.
or I should say that you usually see more and more of?
Yeah. Yeah. So if a woman's still menstruating, she'll notice in her last half of her cycle that she may have some breast tenderness. She may have changes in her mood, whether that's anxiety or even depression and a bit more sadness. There's also going to be just changes in libido throughout the cycle as well. She may also present with cysts, with fibroids, headaches, also premenstrual insomnia. So these things will show up during those 2 weeks. If a woman is in perimenopause and menopause, that's where the hot flashes and night sweats, which is kind of tricky because you would think it's just because the estrogen is low, but really low progesterone will also mimic some of these symptoms. And insomnia is a really big one, and really, really high anxiety. So a woman that has these imbalances, especially with the fibroids. So a lot of doctors will tell women, well, just wait till menopause and it'll shift. So because your hormones are going to tank at that time, so there won't be anything feeding those fibroids. But really what that is, it's indicating that you've been living in estrogen dominance or progesterone deficiency for a good chunk of your lifetime when it comes to your menstrual cycle. So there's an underlying issue with communication in your hormones. So even when you transition, sure, the fibroids may shrink a little bit, but that may turn into a different problem in your body. It might not show up in your uterus, it might show up somewhere else.
Yeah. Can you describe what a fibroid is for women, and maybe
So
some reasons why women become more estrogen dominant?
yeah, so a fibroid is basically your endometrium, like the tissue has come together and it's created almost like I've always pictured them like little golf balls in the uterus. And they can vary in size. They can be quite small, they could be quite large. And the reason for the estrogen dominance in today's world is really the toxicity piece. It's our environment. So pesticides on our foods look like estrogen. The plastics that we're surrounded by, our water supply may have hormones in it. Soy products are in everything. And then just toxicity from the environment, like phthalates and heavy metals, will also change how well our cells are absorbing these nutrients and these hormones. So it kind of changes the ratio of what's getting expressed. And then stress, right? So we're living in a world where we're running from one thing to the next. And in those moments, we're increasing our cortisol to help support that state of stress. But when we're there, progesterone is getting converted into that cortisol continuously. So if we're continuously in a state of survival, we can't necessarily thrive, and the progesterone is not going to be able to do what it needs to do, creating that gap between itself and the estrogen, which creates more of that estrogen dominant picture. And then the last one I want to speak to is insulin. So when insulin is not being managed, that also is going to contribute to estrogen dominance. When we're not sleeping well, that's going to contribute to estrogen dominance. So a lot of women past 35, 40 will start talking about, the fat around their belly and say, I do everything. I'm doing keto, I'm fasting, I'm doing all these things, but I'm not losing weight. And it's because of that extra estrogen dominant state.
Mm-hmm. Yeah, and you hit the nail on the head. It's so common, and it's so common that women actually are living in these estrogen dominant states, not even knowing that they have fibroids, until
Mm-hmm.
maybe a pregnancy or a miscarriage, or enough, I guess, loss of blood where they go and get a pelvic exam. Can you also speak to endometriosis, because I know that's another common one, and it seems so difficult to support in a conventional model?
Yeah, it's a tricky one because it's not well understood and the reasons behind why it shows up. So endometriosis, again, the endometrial lining is essentially trying to escape the uterus. So you may find some of that lining in the ovaries or the fallopian tube. You may find it in the gut. You could even find it in the nasal passages. So depending on the severity of the endometriosis, it's basically there's inflammation. And now this tissue is trying to find a home somewhere else in the body. And it usually does begin with that state of estrogen dominance, but more often what I see with endometriosis, there's been a really deep trauma that's happened that's created that environment. So whether that be sexual abuse or a sexual encounter that didn't feel safe, or some other trauma in their childhood, or even a divorce, these are women that I've worked with in the last 10 years. Those were the triggering moments or experiences that created this place where, or this feeling inside of them that didn't create safety or security. So it's like their uterus then was trying to find that in other places because they were feeling stuck. So when a woman is feeling stuck, a lot of times endometriosis, fibroids, cysts are very much connected to the feeling of resentment or lack of forgiveness for self, and guilt and shame and all these different deep emotions. And the physical aspect of the estrogen dominance is absolutely there, but that shows up usually after the emotion has already created this anchor in their reproductive organs.
Mm-hmm. Yeah, I mean, I'm glad you brought it to that discussion too, because it's obviously such a huge part, and especially the role that women play, as a mom, and this expectation of having to produce and work. It's a very different time for women than what it was 40, 50 years ago even. And so there's definitely a lot more expectation on women, and to be the center of the home, and to be the stability. And so it's also easy for them to not feel that safety net in that community. Um, so yeah, I'm glad you brought attention to that.
Yeah. Well, I also think we should talk about men because we're seeing estrogen dominance in men. So what have you seen, and how have you seen that show up for men in your practice?
Well, I think just to highlight some more points that you talked about. So, I mean, there's a lot of, what do men typically do when they hang out with other guys? Is they drink alcohol, right? There's this you know a misunderstanding around the role of how alcohol can also be a significant disruptor in testosterone and contribute to estrogen dominance. There's also a number of different medications that also contribute to higher estrogen load, like antidepressants, anxiolytics, and things like that. And technically, the more stress we put on our liver, the more we can get out of balance with our testosterone levels. And you also brought up insulin resistance. We know that high insulin equals low testosterone. So if whether or not someone's in this state of insulin resistance or deeper into this diabetic picture, testosterone is going to be manipulated. And often we'll see this concomitant rise in estrogen. So for men, it's kind of similar stuff. We're more moody. We're less patient with our partners or with ourselves. We've lost some of that zest for life, definitely weight gain, the quote unquote man boobs that can show up with higher estrogen in the body. And really, I think a big part of the male psyche is to accomplish and drive and be projection oriented, so getting things done and fixing and that kind of thing. And so when I think that when we start to feel a little bit more insecure in ourselves, or we feel less vitality, lower libido, maybe there's erectile dysfunction going on, there's usually some real obstacles in our estrogen to testosterone ratios. And so over time, in the aging man, that can be prostate issues. It can be like the gynecomastia or the man boobs. It can be all the emotional changes and decreased muscle mass and strength and those kind of things. So yeah, it's a problem for us too. And it's because of these environmental influences, as you spoke to, that are, I guess, increasing the prevalence of this imbalance.
Maybe talk about the connection between estrogen and testosterone, because you spoke about how testosterone is declining. So what does that do to their estrogen, and how does that create estrogen dominance in their bodies?
Yeah, for many reasons, but I think probably some of the most common is that, like, all these hormones, as you spoke to, kind of cascade down from cholesterol, right? And so on one side, you've got the progesterone, which eventually converts into cortisol. And the other side, you've got cholesterol going down to pregnenolone, into DHEA, into estrogen, or into testosterone. And so when that lifestyle is conducive to, higher stress, nutrient depletion, or even some men who are using the hair loss formulas, the 5-alpha reductase inhibitors, and zinc depletes in the body and toxicity rises, we get this natural shift of our testosterone into estrogen. And so we can, we see this a lot even with men doing testosterone replacement therapy. As you give more testosterone, the body will naturally convert a chunk of that into more and more estrogen. And so a lot of men who are doing, TRT as a replacement hormone, they often aren't really taking a close enough look at this relationship to estrogen. And that's super important because, just because you can dump more testosterone, it doesn't mean that, you're going to feel all the wonderful benefit of that, because we have this natural tendency. And I think, for a lot of people too, we don't realize the impact of just liver detoxification, because a lot of the hormones have to be processed through the liver, require certain enzymes, and a lot of us, in this modern world, again, toxicity is probably one of the bigger reasons why, is that our ability to break down estrogen isn't as efficient as it maybe was when we were younger. And so some of us, women included, just have this natural tendency to rise higher and higher levels of estrogen. And so let's take that into the level of blood work. One of the things that we haven't spoken about that's beautiful in the blood work in a hormone panel is the sex hormone binding globulin, which, when that rises as a result of liver toxicity and too much estrogen, too much stress and cortisol, maybe, a really crappy diet, too many carbohydrates, not enough essential fatty acids and those kind of things, mineral deficiencies, zinc goes down, all our detoxification pathways are kind of getting exhausted, and your SHBG starts to rise, or your sex hormone binding globulin. And 98% of your testosterone is bound up to this. So even when we're doing a blood screen for total testosterone, if it doesn't have this reference point of sex hormone binding globulin, that major utilizer of testosterone, once it's bound to that protein, the sex hormone binding globulin, it's ineffective in its use. And so you can have a normal testosterone level in your blood, a high SHBG, and basically that's testosterone deficiency, as a result of this high estrogen.
Yeah, and that's why a lot of times the hormone replacement won't necessarily work, or they're feeling the same, where you hit a plateau, because even the things that you're injecting in, the testosterone is going to get bound up by that sex hormone binding globulin. So then if you reverse engineer that, really the solution to that is to detox, is to support the liver, is to look at the upstreams triggers that are creating that toxicity, is to look at your environment to see, are you eating organic? Are you, what's your home environment like? What products are you using? Are you using things that are going to disturb your hormones in your body? So when looking at that detoxification process really has to be the first step into looking at hormone health.
Yeah. Yeah. And we talk a lot about just, detoxification first as, looking for those source things, and we didn't bring this up, but, metal fillings are a huge source of mercury for all of us. And that becomes a leaching mechanism into our body, which, has this estrogen mimicry process and affects our liver detoxification, all those other things. So that step one might be, really looking at your environment and removing the known sources that you can, maybe visiting, a holistic or biological dentist to help with proper, safe mercury removal, and, switching over to organic, all that stuff. And then the second thing we usually teach is, in order to prepare for detoxification, you have to fix those cell membranes. And so getting, the right essential fatty acids and amino acids in, and all of that stuff. And then the body is more ready to get rid of stuff that it shouldn't be accumulating. So there's a real problem. I mean, there's more to it than that, but I think, setting the stage for people, and it really comes down to, what you speak to a lot, is this communication system. And if we haven't put the right nutrients into the body, we're not going to be able to communicate these hormones effectively to the tissues that need that support.
Yeah, and there's so many nuances to it as well. When you're speaking to zinc, we're seeing more and more, a lot, especially men, are very deficient in zinc, and zinc is actually very supportive for progesterone. So when we're deficient in zinc, maybe there's copper piping in our home and we're not even aware of it, and it's something that we're getting exposed to every single day. So now the ratio in our body between copper and zinc is altered. Maybe a woman has a copper IUD, and that's also affecting her progesterone stores and just how well progesterone's going to work, and how well her body's going to detoxify. The other element of detoxification, the methylation process, that, I think a lot of people have heard of methylation now. It's a fancy word that's out there in alternative medicine. I found out in my DNA testing that I don't methylate well. So that's something that I need to support in my liver in order for my hormones to be healthy and strong. So there's lots of different layers when it comes to hormone health. And I think that's the point that we want to make, is that it's not just about replacing your hormones, and it's not just about testing them and seeing how these hormones are causing the problem. It's about looking at your hormones and then recognizing what are the triggers that have created the communication that have allowed these hormones to get to where they are today.
One thing that I think that would be helpful for a conversation on this estrogen dominant topic is as birth control pills. Like you mentioned the copper IUD, but what kind of role are the birth control pills playing on this estrogen dominant state? And obviously, this can be a really sensitive topic for women because there is some level of security when birth control pills are there. It becomes a lifestyle choice, often first before it becomes a concern for health. So can you speak to that a little bit too in relation to estrogen?
Yeah, I think there's layers to that as well because there's different types of pills, right? So you're either going to get one that's more estrogen, or you're going to get one that's progesterone only, or the estrogen progesterone mix. You want to look at what generation the pill is because a lot of them are actually made from testosterone. So you're not only affecting your receptors for your estrogen and progesterone, but also the ones for testosterone, which will change your libido. It will change your outlook on life, even with your partner. And there, it kind of creates this feeling of numbness almost. But like you said, it's a choice that some women need to make depending on where they are in their lifetime and lifestyle. So you want to make sure you just understand what your particular birth control is made from, what ratio of hormones are in it, and how that hormone will affect your overall outlook in life and also your internal environment when it comes to your hormonal story. So in that moment when you're taking the pills, you may not notice a lot, but as soon as you want to come off of it, say, it's time to maybe start a family, or it's something that you just want to experiment and make sure that your body is functioning on its own too without this exogenous hormone. That transition may be challenging for some women because now we've created this environment where our own stores don't necessarily know what to do when it comes to secreting progesterone and estrogen. We don't have that cyclical movement or flow of these hormones every month. Essentially, we're just getting high amounts of hormones and then they drop, and then we have a letdown bleed. So it's not even really a true shedding of your uterine lining. So I think there's lots of different layers to that question and understanding. When women have the Mirena, it's only progestin. So anytime we put something exogenous in the body that it's not familiar with, the body wants to move into homeostasis always. So it's going to try to find ways to deplete something so that it can create that homeostatic state. So if we're increasing that progesterone that's synthetic, then the estrogen is going to fall. So instead of estrogen dominance, you may have the opposite effect happening where you're not getting enough of that protective estrogen for your bones, for your mucous membranes, for your cardiovascular health as well. And it's very depleting on a lot of our vitamins and minerals like B vitamins, zinc particularly, magnesium. The Mirena specifically has plastic in it, so that's also something to think about. Sometimes it gets dislodged in women and it creates pain during intercourse. So these are just all elements, and I know I'm speaking a lot to the negative elements of it, but it's important to understand so you can make the right decision for yourself. And then there's these positive elements, right? It gives women more control over what's going to happen in their life. Maybe they're in a time in their life where they're going to school or they're working on their career or they're in a relationship that doesn't feel safe. There's elements of this birth control that can give them a sense of power and empowerment that is also important to look at when you're making these decisions.
Yeah, I'm glad you brought that up because I know it's not an easy conversation because you also get used to a way of life with this
Mm-hmm.
level of security and like you said, control. And it becomes, I imagine, again, I'm speaking on the outside in, but I imagine it becomes a difficult decision for women to take that away. And,
Yeah.
so to that point, is there other options that people can do to sort of monitor themselves for when fertility is more likely?
Like different methods of birth control.
Yeah.
So, I mean, again, depends on where you are in your life. If you're in a steady relationship and it's somebody that you're with that maybe in the future you are thinking about starting a family with, there's the rhythm method, right? There's these other elements that you can use. There's the Billings method. Um, So but you have to be really tuned into your body. You have to look at your cervical mucus. You want to be taking your temperature. You want to be monitoring your cycle to see exactly where you ovulate. You want to really get tuned in so that you know what the safe days are in quotation marks and which ones aren't. So you just have a better understanding, and maybe there's other contraceptives that you're using. So it's very dependent. It's so individual. You can't really make a broad statement about like what the best method it really is. I think it's going to really depend on where a woman is in her life.
Yeah, I got a question for you. Like, where would you like to see women, with in their monthly cycle relationship? Because again, I'm speaking as a man. I feel like it would be really empowering to know myself, and the cyclical pattern that would show up each month. Like, I feel like I would, and maybe it's just my personality, I feel like I would really want to know it really well. And yet, that's obviously not the case for everybody. We all have different personalities. But like, what would be your wish for women in this relationship?
Yeah, I think that just taking the opportunity to discover your unique like hormone imprint, which is in your monthly cycle. So getting really tuned in to like what's happening in those first 2 weeks. Like, how are you feeling? What are you craving? How are you moving? What is happening for you in that time? And then also in the second half of the cycle as well. Like, how are things changing for you? How is your mood changing? How is the way you want to exercise changing? So the more tuned in you get, the more you start to understand what's happening, what hormones are shifting and changing, the more you can serve the cycle. So then the cycle can serve you. Because a lot of times women are not looking forward to their cycle because it's creating so much havoc in their relationship to themselves and also their outwardly relationships. It changes how they might be reacting to a situation from like 1 week to another with totally different reactions, which could change their life trajectory. So I think the more tuned in you get, the more grace you can have towards yourself, the more understanding you have of like, okay, this is the week where I am more sensitive. So I'm going to be more sensitive to the world. So maybe I don't watch the news, or maybe I'm just careful of like who I speak to this week, or maybe I'm just taking more self-care time and slowing down a little bit. So the more tuned in we get, the more we understand that there's nothing wrong with us. It's just our cycle is just there to tell us what's happening in our workings. So the more we relate to it, the easier it becomes to flow with it instead of like against it.
I love how you're describing it, because it's like naturopathic medicine for your cycle. You're being
Mm-hmm.
prevention and proactive minded when it comes to knowing how your mood, your energy, your food choices, all these things are influenced so much by the hormones. And hopefully people, when they sort of reflect on that, they just realize the power that these little molecules have in the body, like that chemistry that's created at these different times in the cycle that can be somewhat predictable, and you can kind of plan around it. I was thinking, even, if you're to go on a vacation, or you've got an important meeting or talk coming up, that you could almost be more strategic with what time of the month, and
Well,
that
you can
you
try,
yeah.
and then life happens because
Right.
everybody outside of you isn't going to move with your cycle, unfortunately. Like, your family is not going to move that way, your work life isn't going to. But if you have an understanding of your own response in those experiences, it makes it easier for you, because that would
Mm.
be a whole lot of navigating of like a lot of other people's lives to make sure that it fits, our cycle, which, that would be amazing.
Yeah.
But it's not, I don't know if that's actually realistic. It would be great,
Well,
but
you talk a lot about this. Like, back in the day, all the women used to get together and just sort of
mhm,
have, this community time. This female time.
mhm.
Is there truth to that?
Yeah, well, if we think about women when they're together, their periods will sync together, right? So I think we are meant to flow at the same time, and that would make it a lot easier. But we don't live in that village community anymore. We don't. That's just not what life is in our modern day life. So we have to kind of adjust and pivot to what life is right now.
Yeah. And, for us, like you and me, it's helpful for me to know. Maybe not every
Hmm.
partner wants to know, not that you have to get into all the little details with your partner. But it is helpful to know because I can kind of see your energy shift through the month, and it helps me understand. And again, as long as I'm not labeling you, this is why you're behaving, as I alluded to in the last podcast.
Uh-huh.
But it's helpful, I think, to have that conversation. Like I'm experiencing different hormonal soup right now. This is like, maybe I'm not as interested in cuddling right now, or maybe I just need a little more alone time, or hey, you look really good. Let's go for dinner or something. Like there's maybe different cues or conversation or communication that can happen in a relationship when women take that more active role.
Yeah, it's just you become more tuned in to yourself so that you can create that relationship with yourself. So then your outward relationships are also more relaxed because there's just a deeper understanding.
Yeah.
Yeah.
Cool. All right. Is there anything else that you want to send out there to the world on estrogen dominance and maybe some action steps for people to take?
Yeah, I think just, looking into it more, reflecting on yourself. Is this something that you're dealing with? Look at your environment, look at your triggers, look at your daily choices. Like from the moment that you wake up, what are you using on your body? Will it disrupt your hormones? What are you putting in your mouth? Will that disrupt my hormones? Just being really aware and mindful of the daily choices, I think, is the first step to understand if this is a state that your body may be in.
Yeah. And then maybe next step would be to get some, like,
Get
let's
some
say something's
testing.
happening, get some testing done. Yeah.
Absolutely. Yeah. Get some, and even if, something isn't happening, I think it's good to have a foundation with your testing to see what your hormones are doing. It just gives you a deeper understanding. I've had that happen many times where, because we're not always tuned in to what's happening.
Mm-hmm.
Because like you were saying before, it becomes the normal, right? So in order to step out of that state, we have to disrupt it somehow. So just getting a test done to see what your body is doing in this moment can be really helpful.
Mm-hmm. That's awesome.
Yeah. Yeah.
All right, my beautiful wife. Thank you so much for sharing all your wisdom. We talked a little bit about men too, so, because obviously we're part of the equation as well. So I'm glad we got a chance to talk a little bit more about this really important topic.
Yeah.
We got some fun guests coming up in the weeks ahead, but Sonya and I will keep dropping more information on hormones and your health and women's health, men's health, relationship, et cetera, et cetera. And for those of you that do tune in regularly, please send us some messages. Let us know what topics you're more interested in listening to, or guests that you'd like to have on, and keep the conversation going. So
Yeah.
have a wonderful day. I'll see you
Yeah, you
tonight.
too.